I want to give you an overview of what we're doing in terms of our support, but I think more importantly in terms of what the Pathfinders are doing and what the emerging themes are from them. So if you can move me on. Most of you probably know this already, but just to clarify, the Pathfinders are testing the commitments of the Green Paper, and they have 4 main objectives that they're working towards. So they've been commissioned by the DFE and the Department of Health, started in September last year, and I'll come on to the timeline in the programme, but they are looking to develop a new assessment process and single plan. Now, the key thing is that needs to be focused on outcomes. It needs to involve the services that are provided for children and young people with special education needs and disabilities across education, health and social care. Outcome-focused, person-centred, those are the key elements. The other thing that they're looking at, one of the core objectives, is to explore the role of the voluntary and community sector in this assessment process, so where they're able to provide additional specialist expertise and also independence in the process. They are also looking to ensure, and this is their key one, to ensure that children, young people and their families are at the centre of the process. So all of the Pathfinders have that as a core element of their programme, or they should do. They are also looking to improve choice and control of families and children through the process. So this is the programme, 18 months, challenging programme. They started in September last year, and they've spent quite a bit of time setting up all of the people that are working within the Pathfinder, what their structure is, what their time frame and milestones are, and they started that in September and they're still working on that. The Pathfinders now are looking to recruit their families, so looking to recruit the children and young people that will be testing each Pathfinder's assessment process and will get a single plan. Now that will go on throughout the life of the family, through the life of the programme, mainly starting now, but most Pathfinders will not have children involved in actual testing until July, September time. And a key strand there is the participation and engagement with children, young people and their families, and I'll come on to that a bit later. They will be testing the core elements of the Green Paper and learning from that and feeding that back into other Pathfinders, sharing experiences across and working with key stakeholders to understand what's working and what isn't. There will be a new offer available for children, young people and families. Dependent on where the Pathfinder started, this will be starting from July, but may go all the way through and beyond March. Some Pathfinders may not have a plan in place until December. It depends where they started in the process, and I'll come on to that again later. And then there's also a wider rollout and the evaluation. I have the evaluation at the end. The reason I have it at the end is SQW have been commissioned to evaluate the Pathfinders. They are evaluating the whole way through, but their report will not be available until the end, and the input from parents and families will come later on in terms of the evaluation, so that's why I have it at the end, which is another challenge for this programme. So there are 20 Pathfinders. They represent 31 local authorities and their PCT partners. I've put a list up there for you. We'll put this on the website, and what I'm also happy to do is share a more detailed list of these, so it says who the local authorities are within each of these groupings and who the support advisor is within my team. So you'll see there's a good mix across England. Some Pathfinders are quite small, so we have individual ones such as Calderdale. Others are big consortiums such as SE7, which covers Surrey, Brighton and Hove, Medway and a number of others. The Greater Manchester Pathfinders are also doing some work together as a consortium. Okay. So what have we been commissioned to do? The Pathfinders started in September, and Mot McDonald were commissioned to support the Pathfinders in September as well. So we have a team of support advisors. I'm the project manager for our team, but I'm also a support advisor for a number of Pathfinders, such as SE7, some of the Greater Manchester ones, and Bromley and Bexley. I'm happy to provide you with a list of who the support advisor is for each Pathfinder, if that would be useful. So we are there to provide on-site support as and when they need it. Now that might be challenge and support, because sometimes we will be challenging the Pathfinders to say, this is the direction you're going in, have you thought about doing it this way? We're also there to bring in support from others. So there's a wealth of experience in this room, in this sector. So we're there to say, have you thought about talking to the early support delivery partner or the preparing for adult delivery partner? Have you involved your local forum, et cetera, and pulling that in? What I thought would be interesting would be to give you a flavour of what the Pathfinders are doing on the ground. So for now, they should have all set up their governance structure. So this is who's leading their Pathfinder, who's involved in their Pathfinder, and who will be driving the work moving forward. Now, it's different for all of the Pathfinders. It's not been specified by the department, but they have said that they should be including these types of people. So, for example, in most of the Pathfinders, the Pathfinder lead is from the local authority, from a number of different roles, but is usually from the local authority. In some Pathfinders, the Pathfinder lead is from the PCT, a commissioner, and in some Pathfinders, there's a lead or a co-lead of the Pathfinder is from a parent and carer forum. Then in terms of representation, so this is who signs off the approach that the Pathfinder is taking and testing. Most Pathfinders, and I say most because I don't think all of them do, and this is one of our challenges, have representation from across the local authority, different areas, from health, that's commissioners and providers, from the parent carer forum and councils. Most Pathfinders, apart from a very, very small amount, have parent and carer representatives on their steering group. Also from the voluntary sector, schools, colleges, parent partnership services, and also children and young people groups and forums. They then all have work streams or task groups that are taking off the different aspects and elements of the Pathfinder and developing that. So there may be an assessment and plan work stream, there may be a parent participation work stream, there may be a local offer work stream. Some of those are led by parent and carer representatives, some of them have parent and carer representatives within those groups. There are a few Pathfinders that don't, so again, that's one of our challenges. And the key thing is that the parent and carer representative should be the strategic voice and a decision maker in that group, and involved in co-production, not just consultation at the end of the project. This is what we've decided to do, what do you think about it? Okay? So I thought it would be useful to give you an idea of what the family recruitment is looking like in some of the Pathfinders. It varies vastly dependent on which Pathfinder we're talking about. So for each of the 20 Pathfinders, they will have decided between them which children and young people will be involved in testing the new single assessment and process and plan. So I've given you 3 examples here. Example 1, this is an actual Pathfinder. They're looking at testing with 40 families across the full age range of birth to 25, and their criteria definition is any child whose needs are not met by universal services who has a special education need or disability, and they're looking at new and existing cases so that they can look at children that, for example, already receive a statement and look at that, and then also look at new children that are coming into the process. Pathfinder 2, they're looking at a much different one, so 20 families, and they're only looking at an age range of from birth to 5 years, and they're focusing on the most complex needs, and they're looking at new cases only. And a third Pathfinder, they're looking at 100 families, which is at the top end of the Pathfinders. There are a few looking at that many families going through the test process, but not many, and they're looking at the full age range. So I thought it would be interesting to talk through some of the emerging themes. So in terms of the single assessment and plan, a lot of the Pathfinders are talking about who should have a plan, which children and young people should have a plan, and what should it look like? What should this integrated assessment process look like, and what should the plan look like? They're looking at how to ensure the process is child and family centred, and in this multi-agency context, if we're talking about health, education, social care, who is accountable for the delivery of that plan? And all Pathfinders have stated a commitment that the plan should be the child or the family's plan. So it's not the local authority's plan, it's not the PCT's plan, it's the child's plan. Another emerging issue, which I touched upon before, is parent-carer participation. So when the Pathfinders, when they tendered for the work, so to speak, when they put their offering into the Department for Education and Health, they all committed to working with their local parent and carer representatives and forums. And part of the challenge that we've noted is that what does that actually look like on the ground? And it differs from one Pathfinder to another, in part because Pathfinders are in areas that are starting from different places. So some are very well-established parent and carer forums with very good working relationships with the local authorities and the PCTs, and others not so much. So that's moving along. And also looking at the challenges around capacity of parent and carers, and parents and carers being rewarded and remunerated and made to feel valued as part of this process. So a number of the Pathfinders have started to develop policies around reward and remuneration, but not all of them, so that's a work in progress. Another one is a terminology and language. So it's always the case in this sector, but single assessment, it's never really going to be a single assessment, but what can that look like? How can that be made simpler, less bureaucratic, more transparent? Person-centred approach, what does that mean to the Pathfinders on the ground? The role of the key worker, so key workers are a reoccurring theme, which I'll touch on in a moment. And participation, what does that look like? What should participation, parent-carer participation, children, young people's participation, what should that look like, and what is that in the Pathfinders? The role of the key worker, so I think universally across all of the Pathfinders, they're looking at the role of a key worker, a lead professional, but probably not, a trained facilitator to work with the family through their journey of the assessment and single plan. So they're testing this in different ways, and each Pathfinder is looking at a different type of person to fulfill that role. So some Pathfinders are looking 100% at commissioning the voluntary sector to provide that role. Other Pathfinders are looking at parents and carers being trained into that role, and the voluntary sector, and people from the local authority, and social care and health. I think there's a commitment there from the Pathfinders that parents should be given the choice and should be able to say, this is the person that we want. And if they say this is the person that we want, how do the Pathfinders support that person in training and development to make sure that they are the right person to do that role? Okay? So just to say, in terms of, we have a website, and I'll be cascading all of this information to Sue. We're going to have a new food for thought section on there, which will include information about case studies, what's actually going on in the Pathfinder sites. So that's on there. If anybody's got any ideas about things they would like to see or hear, please let us know. We also have a quarterly newsletter, which is going to be issued next week, which I'll cascade out via Sue again.